pretty doggies. Cutie doggies.
Marissa Gonzalez is on a mission. The Dallas County health worker is going door to door offering free vaccinations.
Good morning. Can I share this with you? I've got a free flu and COVID vaccine clinic right here at the City Hall until 1 o'clock. It's for children and adults. $25 Walmart gift card with COVID vaccines as well for every person. Y'all gotten vaccinated yet?
Yeah, I am.
Okay. What about the babies?
No, I'm kind of scared for this one.
The welcome is lukewarm at best, if not outright suspicious. As our camera approaches one house, a woman rushes back inside.
See, they think I'm nice. See. Hola, señora, buenos días.
Federal immigration raids are taking place across the country. This woman refuses to open the door.
I think they fear that we're immigration enforcement. We have worked so hard to build trust in the community, especially in communities of color. I've been with the county almost 25 years, and I've worked really hard. A beautiful creation that's just been stomped on by the federal government because now there's no trust.
A fear of authorities combined with growing distrust of science. In Texas, vaccination rates are at their lowest level in 15 years. In some counties, they are too low to ensure herd immunity, which this conservative state abruptly discovered last spring.
Fox 26 News at 5 starts now.
Tonight, we start with the measles outbreak.
At least 2 dozen cases of measles have been reported in a West Texas county.
259 confirmed measles cases.
An unvaccinated child hospitalized with measles has died.
25 years after it was eradicated, measles made a comeback in a vulnerable region.
Services is reporting this morning a second child in Texas who had contracted the measles has died.
The viral infection hit this remote West Texas community hard.
How was it for you during the outbreak?
Wasn't expecting it, and so we had studied it in school. I probably didn't take a second thought that we would probably really ever see it.
Unlike him, I thought it would be here because how contagious it is and how under-vaccinated we are. So I wasn't surprised.
Dr. Parkey works at the only hospital in Seminole. The immunization rate here is just 82%, among the lowest in the country. The first measles case was confirmed on January 23rd. The virus spread rapidly, mostly affecting children.
It would just be like red papules everywhere, you know? They would just be covered with. But first the first thing you would see is they would be having fever and feeling ill, and then at the roof of their mouth, you would see these white spots up there. We were seeing probably 15 patients a day with measles. When it was at its peak, the hospital was full the whole time.
Authorities recorded 762 infections in 8 months. Most came from the Mennonite community, a German-speaking religious minority historically distrustful of government and conventional medicine.
We went to the churches, we talked to people. We tried hard to get people vaccinated, but it's ingrained. There's a certain anti-vax portion of the community.
Mennonite distrust of the medical system deepened further amid rumors of forced vaccinations at the hospital. The skepticism peaked after the death of a 6-year-old girl who was unvaccinated, a tragedy that did not change her parents' views on vaccines.
Do you still feel the same way about the MMR vaccine?
Yes, absolutely. We would absolutely not take the MMR. The measles wasn't that bad, and Dr. Edwards was there for us, so.
It was amazing.
Yeah.
He was great.
Hey everybody, welcome to another episode of You're the Cure. I'm Dr. Ben Edwards.
Dr. Ben Edwards is one of the few in the region who gained the trust of Mennonites during the outbreak.
We're excited to bring you another great show today. Remember,
in his weekly podcast, this family doctor gives a platform to leading figures of the anti-vaccine movement.
Titled, how did you start to open your eyes to this topic of vaccines and potential risk and damage from those?
On his website, he promotes a self-healing method that costs nearly $300, which he practices at his brand new clinic, combining holistic medicine and religious beliefs.
My immune system's designed to recognize measles, shingles, tuberculosis, cancer cells even, identify them, tag them, and kill them. We're simply trying to identify what is in this person's life or what's missing in their life that this engineered design requires for optimal, and that's it. AI will never overcome the design of what I call DI, divine intelligence, on this system.
His rejection of conventional medicine was at the forefront during the measles outbreak. Ben Edwards set up an improvised clinic where parents and children, both sick and healthy, shared the same space. Only one camera person was allowed in, a member of Children's Health Defense, the anti-vaccine organization founded by current Health Secretary Robert Kennedy.
How are you feeling? Touch measles yourself?
Yeah, I was pretty achy yesterday.
In this footage, the doctor appears to have a rash. Despite being contagious, he takes no protective measures, going against all medical protocols. When a second child died, the health secretary attended the funeral. Robert Kennedy, a longtime vaccine critic, publicly endorsed Dr. Edwards, calling him an extraordinary healer. A way for the U.S. government to validate anti-vaccine theories and to reinforce the legitimacy of a movement that is a part of the medical landscape. We travel to Amarillo. Inside this building, there is an office that looks just like a pediatric clinic.
Just around the corner, number 3.
But Pia Hassenberg is a nurse. Every day she sees families who often choose her for one very specific reason.
Are you still okay with no vaccines, or have you changed your mind?
No vaccines for now. If we are given enough evidence to support, the need for one in the future, we will absolutely do our research.
And for instance, the measles outbreak didn't scare you at all?
No, because with the measles outbreak that occurred, it was happening mostly in children who were vaccinated.
That claim is false, but widely shared online. According to official data, 93% of children who contracted measles in Texas were unvaccinated. Pia, who meets misinformed or skeptical parents, delivers a well-rehearsed pitch, including graphics.
Unvaccinated versus vaccinated kids, all these issues happen with the vaccinated kid. They're just more susceptible.
But the study claiming a link between vaccines and multiple diseases has been retracted, rejected by the scientific community. The organization that funded it, shown at the bottom of this graphic, has since been dissolved. Yet Pia remains convinced.
Please go ahead.
She believes vaccines cause autism. To prove her point, she asked the Amato family to come in.
What's this? Horse?
Cooper is 11 years old. After a hepatitis B booster shot, he developed symptoms of autism. He barely speaks and avoids eye contact.
He was very interactive. That was the significant thing that I remember, is after that vaccine that we had to catch up on. And it was just like, Koopy, trying to talk to him, and he wouldn't respond. He was just staring forward, kind of zoned out.
His parents have no doubt that these symptoms are linked to the vaccine. Despite no scientific evidence to back that claim, Pia has made a radical decision.
I don't vaccinate anymore here in the clinic.
Do you understand her decision?
Yeah. And I totally agree with it. If we could go back, I would probably not.
Probably not, or delay.
Yeah.
Wish you can just trust the science. What's the science behind it? Well, it's this. It's the wealth behind it. And that's the way I feel.
Awesome.
Greed from pharmaceutical companies and supposedly dangerous side effects. Back in Dallas, Marissa, the health worker, hears these same arguments again and again. With her today, a mother who has brought her 4 children for free vaccinations. She says there's no room for hesitation after facing another disease now making a comeback in Texas due to low vaccination rates.
My third oldest had come down with the whooping cough when he was 2 months old. I am a big advocate on vaccines, and that was the scariest moment I've had in my life, where my kid's going blue and I'm trying to suction him.
Dr. Philip Huang leads local health services. He says cases like this are a wake-up call.
A lot of people, yeah, they do question, okay, well, we don't have measles around here. Why do I need to get this vaccine, especially if someone's saying it might cause autism? But it's just because of the effectiveness and safety of this vaccine that we haven't seen it. But social media can just amplify these incorrect, false messages, and it seems as credible as the real information.
And the obstacles keep piling up. In Texas, school vaccine exemption requests have risen by 36% in 2 years and are increasingly easy to obtain. At the same time, Washington has cut federal funding put in place during the pandemic. Dr. Huang lost $4 million in funding in just 1 year. He's had to cancel 50 vaccination drives like this one and lay off 27 staff members.
We need to sustain this support and funding so that if we do get something again like COVID, we're prepared. But it's become so politicized. How are we going to deal with this as we move forward? Because we're very vulnerable, and the whole country is vulnerable, and they don't understand it.
Trump administration budget cuts have also targeted medical research. We reached out to 10 universities and research centers in Texas. Some have lost tens of millions of dollars in funding. They all declined our interview requests. One university researcher, however, agreed to testify, anonymously by phone only.
And I think the institutions don't want us to really be out there talking about this because they don't know which institutions will be the next one that the administration goes after. And so, everyone's trying to lay low underneath the radar with all of this.
So it seems that their fear-based strategy is working, right?
Oh, yeah. Oh, definitely. It's a very, very, very dark time right now for us. It's very embarrassing. This is just not what our country stands for and never has. And people are going to get sicker. They're not going to, I just don't know what, are we going to be able to take care of people in the way that we expected?
The Trump administration is planning to further cut the health department budget by $30 billion in 2026.